Hi, I'm Dr. Betsy Davis, psychologist and local recovery coordinator here at the South Texas Veterans Healthcare System. For Mental Health Awareness Month in May, we're doing a series of videos about what to expect when you're seeking mental health services here at the South Texas VA. The goal is to demystify the process of seeking care and make it a little bit easier for you to take that first step if you need to. So I'm here today with Physician's Assistant Felipe Villa, and we're here to talk a little bit about what to expect when you're requesting a same-day appointment for a mental health concern. So Felipe, you work in the 1E clinic, which is a same-day clinic at the Audie Murphy Hospital, right?
Correct.
So can you talk to us a little bit about what happens, kind of walk us through the process of whenever someone shows up and requests a same-day appointment in the 1E clinic?
Well, the clinic's open from 8:30 to 4 o'clock Monday through Friday, right? We're located in the 1E clinic. That's the first floor of the Audie Murphy VA Hospital. And it's usually a walk-in clinic. So if you walk into the clinic, you can check in, and the first things, they'll take your name, check you into the clinic, and a nurse will come out, bring you to the back, take vitals, triage you, find out what brings you in for that purpose. And then they'll notify one of the providers, and it's usually myself as they're working from 8 to 4 o'clock, and then we'll bring back the patient. And usually the time slot is between about 30 minutes per person.
Okay.
Sometimes it's a little bit more, sometimes it's less, depending on the needs of the patient.
Sure.
Okay, so usually what we deal with is like medication refills, is to establish care, consult services. We also have substance abuse as the entry available as well. Pretty much anything that doesn't require an emergency. Okay. Now, during the interview, if we find that there is an emergency going on, patient realizes that they're suicidal, there's a safety concern, then we may transfer from the same-day clinic to the emergency room. But that's a rare event. Usually, we just deal with what's going on with the patient. We help out as best as we can, okay? Whether we need to set up a referral to a patient or a follow-up, or if they need medications until their next appointments.
So what kinds of concerns would be appropriate or not appropriate for this kind of same-day or walk-in appointment?
Well, anything that doesn't require safety concerns. Okay, safety concern would be if a patient is suicidal, they want to hurt themselves, or they're experiencing thoughts of hurting other people, or they deteriorated so much that they can't take care of themselves, whether they have a psychosis or they just can't take care of themselves. Those things need to be dealt with in the emergency room, where there's more people, stronger support. Okay. Anything else, med refills, establishing care, traveling vets, anybody that needs a referral to the substance abuse program, or they need a medication question answered, or they need their medications rearranged, we can do that in the same day clinic. Okay. And we're very flexible, so we can do in-person one-to-one, we can do telephone interviews, we can do video interviews. Okay. So you don't even have to show up to the clinic. You can call the clinic and ask for a video appointment, and we can establish that either by video or by telephone.
Great.
We set you up for an appointment, and that way, you can be seen. Anything that we can do to expand care for the patient, we can do.
Awesome. So, and the veteran has to be enrolled in care at the South Texas VA, but they don't necessarily have to be assigned to a mental health provider. Right. Is that right?
They have to enroll, otherwise we can't access their medical records. Mm-hmm. So the first step would be to go to the eligibility office, which is at the main entrance to the hospital. Mm-hmm. You enroll into the system, and we have access to the computer files. You do not have to have a primary care provider. We're one of the few services that can refer directly to the psych services, and we can see the patient as long as they're eligible for services at the VA.
So how is a same-day or walk-in appointment different from like a regular scheduled visit?
Well, regular scheduled appointments, usually with primary care, mental health, they're longer in duration. They're usually with a provider that's already either going to be established, like your first visit, usually a 45-minute visit, or a follow-up visit, which can be anywhere from 30 to 45 minutes, depending on the providers. And unlike those visits, the ones that we have are more focused, problem-oriented, so whatever the patient needs at that time, we can help out. So the appointments are less, usually about 30 minutes. The usual run is about 20 minutes to 25 minutes, depending on the patient's needs, okay? Sometimes we'll go more, okay? Again, it depends on, it's patient-oriented, so it depends on what the patient needs, okay?
Yeah. So I'm kind of hearing that the same-day clinic is a good place to start and a good place to kind of get maybe bridge care, but it's not a good replacement for ongoing follow-up.
Right, because we're not designed to like, we don't usually do therapy because we don't have a therapist. We usually have medical providers, the ones that prescribe. So visits are short, so they're not inducive for long-term care. We can follow a patient until they get assigned. So say they come in, we prescribe a medication, we'll follow them up in the same-day clinic until they get a new provider that'll be the regular medical doctor, either psychiatrist, psychologist, or a primary care, and then they take over their care. Gotcha. So they're not left hanging, here's medication, so you're now about 3 years or so.
And last question, can you talk about when and where veterans can be seen for these same-day or walk-in appointments?
Well, currently, every clinic, whether they're primary care or whether mental health, should have a walk-in clinic. Now, some clinics may not have a prescriber available, so it might be like a psychologist, a social worker, sometimes a nurse. But if they require something other than like a consult or something, they'll refer them back to the 1E clinic.
Okay.
So, then because we always have the providers that can prescribe, either PAs, nurse practitioners, and we have a psychiatrist overseeing us as well.
Okay, so 1E is a great hub for these walk-in appointments, even though they're available at other clinics as well. Great. Well, thank you so much for taking time to talk with me. I hope this provides a little bit more clarity about when to seek care through a same-day appointment, or when to wait for your next appointment, or even go into the emergency room if that's needed. And if you have any follow-up questions, feel free to reach out to your mental health or primary care provider.